24 hours before my retirement party, I was replaced by the CEO's niece. The $130 million deal I'd spent 3 decades building? Gone overnight. But what they didn't know was that I'd built something they couldn't steal, couldn't replicate, and couldn't survive without. Before we jump back in, tell us where you're tuning in from. And if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. The fluorescent lights hummed their familiar tune as I stared at the final authentication screen. 3 decades of sleepless nights, missed family dinners, and sacrificed weekends had led to this singular moment. My fingerprint hovered over the biometric scanner that would unlock the largest pharmaceutical licensing agreement in Morrison Biotech's history. 30 years of climbing from lab assistant to chief scientific officer, and tomorrow I would finally walk away with my head held high. The Nexus Protocol sat waiting on my screen like a patient guardian. I'd architected every line of code, every security layer, every failsafe mechanism that protected our revolutionary cancer treatment formulas. The system wasn't just software. It was my legacy, designed to ensure that our life-saving innovations would reach patients worldwide while protecting the intellectual property that took decades to develop. My office door burst open without warning. Charles Morrison, our CEO, strode in with his characteristic swagger, but something felt different. His usual confident smile seemed forced, rehearsed. Behind him walked a young woman I'd never seen before, though her sharp blue eyes and angular jawline immediately betrayed her genetic connection to our company's founder. "Sarah," Charles announced without preamble, "I need to discuss some immediate changes to our leadership structure." I turned from my workstation, leaving the authentication screen open. The cursor blinked steadily beside the prompt that read, "Executive authorization required, S-Chen access only." 24 hours before my retirement, and he wanted to discuss leadership changes? The irony wasn't lost on me. "What kind of changes?" I asked, though something in his tone already suggested I wouldn't like the answer. "We're implementing a generational transition," he said, gesturing toward the young woman beside him. "This is Victoria Morrison, my niece. She'll be assuming your responsibilities effective immediately." The words hit me like a physical blow. Immediately? I'd given this company 3 decades of my life. I'd turned down offers from every major pharmaceutical company in the world. I'd built their entire research infrastructure from the ground up. "Charles, my retirement ceremony is tomorrow. The Nexus Protocol launch is already handled," Victoria interrupted, stepping forward with a confidence that felt manufactured. "I've been studying the project files upstairs. The transition will be seamless." Studying the project files, as if 30 years of pharmaceutical research could be absorbed through PowerPoint presentations and executive summaries. I bit back my initial response, choosing instead to study this young woman who apparently thought she could step into my shoes overnight. Victoria couldn't have been older than 28. Her designer blazer probably cost more than my monthly salary when I first started here. She held an iPad like it was a magic wand, occasionally glancing at it as if it contained all the answers to questions she hadn't yet learned to ask. "The board appreciates everything you've contributed," Charles continued, his voice taking on that diplomatic tone he used during difficult conversations. "But we need fresh perspective for the next phase of our growth. Victoria brings innovative thinking and digital native insights that will propel Morrison Biotech into the future." Digital native insights. The phrase made me want to laugh. Did he think pharmaceutical research was like managing a social media account? That decades of molecular chemistry expertise could be replaced by someone who grew up with smartphones? "I see," I said quietly, my gaze drifting back to my computer screen. The Nexus Protocol waited patiently, its security algorithms humming in the background. Only I knew about the embedded authentication requirements I'd built into the system after our devastating cyber attack 2 years ago. The attack that had nearly cost us everything, the one I'd quietly thwarted while Charles was giving interviews about our, quote, robust cybersecurity measures. "Security will escort you out and arrange for your personal items to be delivered," Charles added, already moving toward the door. "Victoria, I'll leave you to familiarize yourself with the office. Escort me out." Like I was some disgruntled employee who might steal office supplies on my way to the parking lot. The woman who had built this company's entire research division, who had personally recruited half the scientific staff, who had designed the very systems that kept their most valuable assets secure. "Congratulations, Victoria," I said, standing slowly and extending my hand. "I hope you understand the magnitude of what you're inheriting." Her handshake was firm but brief, like she'd practiced it in business school seminars. "Thank you, Sarah. I'm excited to bring some modern efficiency to the department." Modern efficiency. Another buzzword that revealed just how little she understood about the complexities of pharmaceutical development. You couldn't innovate life-saving treatments with efficiency metrics and quarterly projections. Science required patience, persistence, and deep understanding, qualities that came from decades of experience, not executive training programs. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. I gathered my personal items slowly, deliberately. My leather portfolio, worn smooth from years of carrying it to conferences around the world. The small succulent plant my research team had given me for my 50th birthday. A framed photo from the ceremony where we'd received FDA approval for our first breakthrough treatment, a moment that had felt like vindication for all the years of struggle and sacrifice. As I packed, Victoria settled into my chair and began examining my computer setup. She clicked through various applications with the casual confidence of someone who assumed all systems would bend to her will. She had no idea that the Nexus Protocol required more than just administrative access. It needed the original architect's biometric signature, location verification, and a dozen other security layers I'd built in after learning from our past vulnerabilities. "The Heidelberg presentation files," Victoria called out as I reached the door. "Where are they stored?" I paused, my hand on the doorframe. The Heidelberg files contained our complete research methodology for the cancer treatment trials. 3 years of painstaking work that had established Morrison Biotech as a leader in oncological research. "They're integrated into the Nexus system," I replied truthfully. "Everything you need should be accessible through the main portal." What I didn't mention was that accessing those files required clearance levels that couldn't simply be transferred from one user account to another. The system I designed was like a sophisticated vault. It recognized not just passwords and access cards, but behavioral patterns, location data, and biometric markers that had been calibrated specifically to my work patterns over the past 5 years. "Perfect," Victoria said, already clicking through menus she clearly didn't understand. "I'm sure I'll figure it out." I walked down the hallway. I'd traveled thousands of times, past the laboratories where I'd spent countless late nights perfecting formulations, past the conference rooms where I'd defended our research budgets to skeptical board members, past the offices of colleagues who had become like family over the decades. None of them looked up as I passed. Word traveled fast in corporate environments, and everyone understood the politics of survival. Acknowledging the departing executive might be seen as disloyalty to the new regime. I didn't blame them. They had mortgages and families to consider. But the silence stung more than I'd expected. These were people I'd mentored, promoted, fought for during budget meetings. Dr. Martinez, who I'd recruited from Harvard and who now ran our immunology division. Jennifer Walsh, who'd started as my research assistant and had become one of our most respected project managers. They kept their eyes carefully focused on their computer screens as I passed, typing with an intensity that suggested they were working on something far more important than avoiding eye contact. The security escort was a young man named David, who'd started in the company's protection services just 6 months ago. He was professional but clearly uncomfortable with the situation, probably having heard enough office gossip to understand that something unusual was happening. "Dr. Chen," he said quietly as we waited for the elevator, "I just wanted to say it's been an honor working with you. My sister is a cancer survivor, and she always talks about how Morrison Biotech's treatments saved her life." His words caught me off guard. In all the corporate maneuvering and political positioning, it was easy to forget why we did this work. Behind every research project, every late night in the laboratory, every frustrating negotiation with regulatory agencies, there were real people whose lives hung in the balance. "Thank you, David," I managed. "That means more than you know." The elevator doors opened, and we descended through the floors I'd helped design when we'd moved into this building 8 years ago. I'd insisted on specific laboratory configurations, particular ventilation systems, specialized storage areas that would accommodate our research needs for decades to come. Every floor represented some aspect of the empire I'd built, piece by piece, grant by grant, breakthrough by breakthrough. As we reached the parking garage, my phone buzzed with a text from my daughter Emily. "Mom, can't wait for tomorrow's party. Dad's been practicing his speech all week and it's terrible but sweet. Love you." Tomorrow's party. The retirement celebration that Charles had probably already canceled or postponed indefinitely. 40 family members and colleagues gathered to honor 3 decades of service that had apparently been deemed expendable in a single afternoon conversation. I sat in my car for a long moment before starting the engine. Through the garage's concrete pillars, I could see the upper floors of Morrison Biotech's headquarters, including the corner office that had been my professional home for the past 8 years. The lights were still on, and I imagined Victoria clicking through systems she didn't understand, probably growing frustrated as the Nexus Protocol's security features began asserting themselves. The drive home took me past the small cafe where I'd spent countless early mornings reviewing research data before heading into the office. Past the university where I'd completed my doctoral thesis on molecular immunology, back when Morrison Biotech was just an ambitious startup with more vision than resources. Past the hospital where our first successful treatment had saved the life of a 7-year-old boy, transforming theoretical research into tangible hope. My house sat quiet in the evening light, its windows dark except for the automatic timer that turned on the front porch lamp at sunset. James wouldn't be home from his consulting trip until late tonight, which meant I'd have hours to process what had happened before having to explain it to someone else. I poured a glass of wine and sat at my kitchen table, staring at my phone. Already, the company's internal messaging system had been updated to reflect new leadership structures. Victoria Morrison was listed as Chief Scientific Officer, effective immediately. My name had been moved to a legacy leadership section that made me sound like a historical footnote rather than the architect of the company's most valuable assets. But as I sat there, something unexpected began to happen. Instead of anger or despair, I felt a strange sense of anticipation. Charles Morrison thought he could simply transfer 30 years of expertise and institutional knowledge to his inexperienced niece. Victoria believed that confidence and ambition could substitute for deep technical understanding. They had no idea what they'd just set in motion. The Nexus Protocol wasn't just a filing system or a database. It was a comprehensive security architecture that I'd designed to protect Morrison Biotech's most valuable assets from exactly the kind of corporate incompetence I'd just witnessed. Every access point required verification that went far beyond simple passwords or administrative privileges. The system demanded biometric authentication that had been calibrated to my specific physiological markers. It required location verification from the secure terminal in my former office, using environmental sensors that confirmed the user's physical presence in the authorized workspace. Most importantly, it incorporated behavioral analysis that could detect when someone other than the original architect was attempting to access critical systems. I'd built these protections not out of paranoia, but out of experience. 2 years ago, Morrison Biotech had suffered a sophisticated cyber attack that nearly compromised our entire research database. While Charles had hired expensive consultants to assess our vulnerabilities, I'd quietly implemented a new security framework that made our most sensitive data virtually impregnable. The board had approved my security recommendations without fully understanding their implications. They'd been more concerned with compliance requirements and insurance policies than with the technical details of implementation. Charles had signed off on protocols he'd never bothered to read, trusting that his chief scientific officer knew how to protect the company's interests. Now that trust was about to be tested in ways none of them had anticipated. My phone remained silent as the evening progressed. No calls from panicked colleagues, no emergency meetings, no desperate attempts to recall me from my forced retirement. Victoria was probably still clicking through menus, assuming that persistence and determination would eventually unlock whatever systems she needed to access. I imagined her growing frustration as the Nexus Protocol's security features began asserting themselves. Error messages that provided no useful information, authentication failures that couldn't be resolved through standard IT support channels, access denied prompts that offered no appeals process or alternative authorization methods. Tomorrow morning would bring new challenges as Victoria attempted to present herself as Morrison Biotech's new scientific leader. She'd scheduled meetings with department heads, planned presentations for key stakeholders, arranged calls with regulatory agencies that were expecting updates on our ongoing research projects. But without access to the Nexus Protocol, she'd be operating blind. The system contained not just our research data, but our compliance documentation, our regulatory correspondence, our partnership agreements with academic institutions, and our strategic roadmaps for future development projects. More importantly, it contained the authentication keys for our partnership with Pinnacle Pharmaceuticals, the $130 million licensing agreement that would bring our cancer treatment to global markets. The deal that Charles Morrison had probably already celebrated as a crowning achievement for his family's company. The agreement required final authorization from Morrison Biotech's chief scientific officer, using biometric verification protocols that couldn't be transferred, delegated, or overridden. Victoria might hold the title, but the system would recognize only the person who had negotiated every clause, reviewed every technical specification, and embedded her own security signature into the final documentation. As I finished my wine and prepared for bed, I felt something I hadn't experienced in years: the quiet satisfaction of watching a well-designed system operate exactly as intended. Charles Morrison had gambled his company's future on the assumption that expertise could be instantly transferred, and that loyalty could be discarded without consequence. Tomorrow, he would begin learning the true cost of that assumption. The first sign came at 6:47 a.m., delivered through a simple text message that would unravel everything Charles Morrison thought he'd accomplished. Dr. Chen, system lockout in progress. Victoria can't access Heidelberg files. Emergency meeting called for 8 a.m. Please advise. Dr. Martinez. I set my coffee cup down slowly, reading the message twice before responding. Marcus Martinez had been my deputy for 8 years. A brilliant immunologist who understood both the science and the politics of pharmaceutical development. If he was reaching out this early, Victoria's first day as chief scientific officer wasn't going according to plan. I didn't respond immediately. Instead, I opened my laptop and accessed the remote monitoring system I'd built into the Nexus Protocol. The dashboard showed exactly what I'd expected: 17 failed authentication attempts, all originating from my former office terminal. Victoria had been trying to access the system since 7:15 a.m., each attempt generating an automated security alert that flagged unauthorized access attempts. The beauty of the system I'd designed was its elegant simplicity. It didn't lock users out with dramatic error messages or threatening warnings. Instead, it simply waited, patiently declining to provide access while offering no explanation for its refusal to cooperate. To someone unfamiliar with its architecture, it would appear to be a standard software glitch rather than a sophisticated security protocol. My phone rang as I was reviewing the access logs. Emily's name appeared on the screen, and I remembered with a sharp pang that today was supposed to be my retirement celebration. "Mom, I'm so sorry," she began before I could even say hello. "Dad just got a call from his office. There's some kind of emergency, and they need him to fly to Seattle today. He's devastated about missing your party." Another casualty of corporate politics. James had been looking forward to this day almost as much as I had, proud of his wife's 3 decades of scientific achievement, and excited to finally have her home for more than just weekends and holidays. "It's okay, sweetheart," I said, though the words felt hollow. "These things happen." "No, it's not okay. This was supposed to be your day. 30 years of saving lives and breakthrough research, and now Dad can't even be there to celebrate with you." Saving lives. Emily's words reminded me why I'd endured the long hours, the political maneuvering, the constant pressure to produce results that could be translated into shareholder value. Every late night in the laboratory, every rejected grant proposal, every failed experiment had been justified by the possibility of developing treatments that could give families more time together. "Actually, honey, there might not be a party today anyway," I said carefully. "There have been some changes at the company." I explained the previous day's events as gently as possible, watching my daughter's excitement transform into indignation. Emily had grown up understanding that her mother's work mattered, that the sacrifices our family had made were in service of something larger than personal ambition. "They can't do that," she said, her voice rising. "You built that company. Half their patents have your name on them." "They can do it," and they did, I replied. But sometimes these situations reveal more about character than we might expect. After ending the call, I spent the morning tending to my neglected garden, pulling weeds and deadheading flowers while my phone buzzed with increasingly urgent messages. Dr. Martinez texted 3 more times. Jennifer Walsh, my former research coordinator, sent a carefully worded message asking if I was available for consultation on ongoing projects. Even David from security sent a brief note saying that people were asking questions about yesterday's sudden departure. I ignored them all, focusing instead on the therapeutic rhythm of gardening. There was something profoundly satisfying about nurturing growth, about understanding that some processes couldn't be rushed or shortcut, no matter how much pressure was applied. Plants required time, patience, and proper conditions to flourish, qualities that seemed increasingly rare in corporate environments obsessed with quarterly results and immediate gratification. At 11:30 a.m., my phone rang with a number I didn't recognize. The voice on the other end was crisp, professional, and unfamiliar. "Dr. Chen, this is Amanda Richardson from Pinnacle Pharmaceuticals. I'm calling regarding the final authorization for our licensing agreement. We were expecting confirmation this morning, but we've encountered some technical difficulties." Pinnacle Pharmaceuticals, the global distribution partner that would bring our cancer treatment to markets across Europe, Asia, and South America. The $130 million deal that represented the culmination of 5 years of research, development, and regulatory navigation. "I'm sorry, Ms. Richardson," I said carefully, "but I'm no longer with Morrison Biotech as of yesterday. You'll need to speak with Victoria Morrison, the new Chief Scientific Officer." There was a long pause on the other end of the line. "I see. We weren't informed of any leadership changes. Our legal team reviewed the contract terms this morning, and the authorization protocols specifically require biometric verification from Dr. Sarah Chen." "Are you saying those requirements have been modified?" "The authorization protocols." The carefully crafted language I'd insisted upon after learning about security breaches at other pharmaceutical companies. The contract specified that final approval required not just the chief scientific officer's signature, but biometric verification from the individual who had designed and implemented the security architecture protecting the licensed technology. "No modifications that I'm aware of," I said truthfully. "You'll need to discuss any contract changes with Morrison Biotech's legal department." "Dr. Chen, I don't mean to put you in an awkward position, but this agreement represents a significant investment for Pinnacle. If there are unresolved authorization issues, we may need to reconsider the timeline for implementation." The timeline for implementation. Corporate speak for, "We might walk away from this deal if you can't provide the security assurances we've already negotiated." Pinnacle had built their entire European expansion strategy around Morrison Biotech's cancer treatment. Delays or uncertainties could cost them millions in preparation costs and lost market opportunities. "I understand your concerns," I replied. "I'd recommend speaking directly with Charles Morrison about resolving any technical issues." After ending the call, I found myself thinking about the broader implications of what was unfolding. The Nexus Protocol wasn't just protecting proprietary research data, it was safeguarding the integrity of partnerships that had taken years to establish. Pinnacle Pharmaceuticals had chosen Morrison Biotech over larger competitors because of our reputation for scientific rigor and security protocols that exceeded industry standards. That reputation was built on 3 decades of consistent performance, careful relationship management, and technical expertise that couldn't be replicated through PowerPoint presentations or executive training programs. Victoria might hold the title of Chief Scientific Officer, but she lacked the deep understanding of molecular chemistry, regulatory requirements, and international partnership dynamics that such a role demanded. My laptop chimed with an email notification. The sender was Dr. Rebecca Thompson, Director of Oncological Research at Johns Hopkins University. Rebecca and I had collaborated on numerous projects over the years, and she'd been instrumental in providing the clinical trial data that had validated our cancer treatment's effectiveness. Sarah, I just heard through the grapevine about your retirement. Congratulations on an incredible career. I'm reaching out because we've been discussing expanding our research partnership with Morrison Biotech, but I wanted to confirm you'd still be involved in the oversight process. Our institutional review board specifically requested your continued participation given your expertise in this area. Another partnership that assumed my continued involvement. Johns Hopkins represented one of the most prestigious medical research institutions in the world, and their willingness to collaborate with Morrison Biotech had elevated our company's scientific credibility immeasurably. Their research partnership had provided access to clinical resources and patient populations that would have been impossible to secure independently. I crafted a carefully neutral response explaining that my role at Morrison Biotech had concluded and suggesting that Dr. Thompson contact the company directly to discuss future collaboration arrangements. I didn't mention that Victoria likely had no idea such partnerships existed, much less understood the complex regulatory and ethical requirements that governed academic industry research collaborations. As the afternoon progressed, the messages became more urgent and less diplomatic. Dr. Martinez called twice, leaving voicemails that grew progressively more strained. Sarah, we really need your input on the Pinnacle situation. Victoria is struggling with the technical requirements. Could you possibly come in for a brief consultation? Jennifer Walsh sent a series of increasingly desperate texts. System won't accept any authorization attempts. IT department says they can't override security protocols. Charles wants to know if you left any documentation about access procedures. Documentation about access procedures. As if 3 decades of expertise could be distilled into a user manual that Victoria could follow, like assembling furniture from a hardware store. The security protocols I'd implemented were designed specifically to prevent unauthorized access, even from individuals who might possess administrative credentials or executive authority. But perhaps the most telling message came from Victoria herself, sent at 4:17 p.m. with a subject line that read, "Urgent assistance needed." Dr. Chen, I hope you're enjoying your retirement. I'm writing to request your assistance with some technical issues we're experiencing with the Nexus Protocol. As I'm sure you understand, continuity of operations is important for all stakeholders. Would you be available for a brief consultation to help resolve these access challenges? I'm confident we can work out appropriate compensation for your time. Appropriate compensation for my time. She was offering to pay me consulting fees to fix problems created by her assumption that expertise could be transferred like company property. The woman who had displaced me less than 24 hours ago was now asking for my help to access the systems I designed and implemented. I deleted the email without responding. Instead, I opened a bottle of wine and settled onto my back porch, watching the sunset paint the sky in shades of orange and pink. The silence was remarkable. No urgent phone calls, no crisis meetings, no desperate attempts to solve problems that could have been avoided through basic respect and proper planning. For the first time in years, I felt genuinely free. Free from the constant pressure to prove my worth to executives who valued political connections over scientific expertise. Free from the exhausting task of translating complex research into simplistic presentations for board members who measured success purely in financial terms. Free from the responsibility of protecting institutional knowledge that was apparently considered expendable. My phone buzzed with a final message of the day, this time from Charles Morrison himself. The text was brief and direct. Sarah, we need to talk. When are you available? I read the message 3 times before responding with equal brevity. I'm retired as of yesterday, Charles. Enjoy your family's new leadership structure. As darkness settled over my neighborhood, I reflected on the strange turn my life had taken in just 24 hours. Yesterday morning, I'd been the chief scientific officer of a leading pharmaceutical company, responsible for research projects that could impact millions of lives. Tonight, I was a retiree, with no official obligations, no corporate responsibilities, and no access to the laboratory facilities where I'd spent most of my adult life. But I was also the architect of security systems that were currently protecting Morrison Biotech's most valuable assets from the very leadership that had dismissed my contributions. The Nexus Protocol was operating exactly as designed, patiently waiting for authorization that could only come from someone who understood both its technical requirements and its underlying purpose. Victoria Morrison might hold the title and occupy the office, but the systems I'd built recognized something more fundamental than corporate hierarchy. They recognized expertise, consistency, and the deep understanding that came from years of careful development and refinement. Tomorrow would bring new challenges as Charles Morrison began to grasp the full implications of his decision. Pinnacle Pharmaceuticals would grow increasingly frustrated with delays they couldn't understand. Academic partners would question Morrison Biotech's stability and reliability. Regulatory agencies would demand explanations for disruptions in communication and documentation protocols. But tonight, I simply enjoyed the quiet satisfaction of watching a well-designed system operate according to its principles, protecting valuable assets from those who had failed to appreciate their true worth. The irony wasn't lost on me. In trying to replace me, Charles Morrison had created a situation that demonstrated exactly why my expertise had been irreplaceable. The real test would come tomorrow, when the consequences of corporate arrogance would finally demand accountability from those who had prioritized family connections over institutional knowledge. I had no intention of making their reckoning any easier than it needed to be. Up next, you've got two more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.